I'm Kellyanne Garthy, and I'm an RN, and I'm here with Diabetes Support Services to talk to you today about how to do an insulin injection. So now that you've been diagnosed with diabetes and you're moving into having to give yourself insulin injections or give your family members insulin injections, it's probably the most nerve-wracking aspect of having diabetes. So I want to just do a little quick demonstration on how you do that, and also show you some of the equipment that you would use to give yourself or your family member or friend insulin injection. First we have your insulin. And your insulin for a lot of people will come in a vial that you'll draw up using your insulin syringe. There's lots of different types of insulin syringes. But the most important thing is to make sure that you have a syringe that's specifically for insulin. Your insulin syringe might be able to hold 30 units, such as this one. This one holds 50 units. And then you can also get them that will hold up to 100 units in the event that your dose of insulin is greater than 50 units. So the insulin syringe is very small and has very tiny little numbers. So if you have difficulty with vision, you're probably going to want to have some sort of magnifying glass to make sure that you're getting your accurate dose of insulin. Your vial of insulin will typically be multi-use, which means that you can use it many times to get the dose that you need on each subsequent administration of insulin. You're also going to want to make sure that you have alcohol swabs. The alcohol swabs will be for, first of all, wiping off the top of your multi-use vial, and then also for wiping off the site on your body that you're going to inject yourself with insulin. So first let's talk about how you draw up insulin from your vial. First, you want to make sure that your vial has enough insulin in it to get the dose that you need. So let's say, for example, you need to give yourself 5 units of insulin. Units are the unit of measurement for insulin, and it'll say it right along the side of your insulin needle. So you see on this syringe, there's a total of 30 units that can go into this syringe. And on this syringe, there is a total of 50 units, even though they both kind of look to be about the same size. So if a person was going to give themselves 5 units of insulin, then either of these syringes would be good for that. When you take off the top, just to look at the needle, you can see that it's a very tiny, very slim needle. You probably can't even see it very well. The gauge of that needle is a 30 gauge. 30 gauge is almost the thinnest needle that you can possibly get. You can also get a 31 gauge, a 29 gauge. This needle is a 29 gauge, and then on this package it will also tell you how long the needle is. So this one came from this package, and it's 5/16 of an inch. So you can imagine that that's a pretty short little needle. So you look along the side and you see the amount of units that you want to draw up. So in this case, we're going to draw up 5. So with just air, you're going to pull back to 5. Because what we're going to do is inject the same amount of air into the vial of insulin that you're going to draw up from the vial. So I'm going to inject 5 units of air into this vial so that I can pull back 5 units of insulin for administration. And the reason we do that is because the vial has a vacuum, and you want to make sure that you're breaking the vacuum in order to accurately pull up your correct dose of insulin. So before you put your needle in there, you want to make sure that you wipe off the top of the stopper. There's a little stopper there in between all of that metal, and that's going to be where you'll put your needle for pulling up the insulin. So 5 units. I've pulled back 5 units of air, and you just go right in the middle of that stopper. And you can inject the air and push the plunger, this is the plunger, all the way down until all of the air has gone into the vial. At which point we're going to invert the needle and the vial so that we don't have air come into the syringe when we pull up the amount of insulin that we need. So make sure all of the air has gone into the vial, invert the vial, and then you can go ahead and pull back so that your syringe starts filling up with insulin. And you can pull back further than your dose to begin with, because at that point you'll push back up to the correct dose. And that will get rid of any air bubbles that may have been inadvertently or accidentally drawn up into the syringe. So let me repeat that. Insulin needle, 30 gauge, and we're going to give 5 units of insulin. So I pull back 5 units of air, wipe off my stopper, and make sure that it's dry. Once it's dry, put the needle into the stopper and push in the amount of air. Invert, and then pull back the insulin. If you have an air bubble, pull back further than the dose needed, and then push back up to your correct dose so that any amount of air can be put back into the vial. So once you've verified that you have accurately pulled up your correct dose, in this case 5 units, you can take your needle out of the vial and prepare to give yourself an injection. In the event that you have difficulties getting the bubble out of your syringe, you can actually pull back a little bit of extra, pull this out, or you could even leave it into your vial and just give it a little tap so that the bubbles will float to the top, and then you can effectively push any bubble back into the vial. So just verify that you have the correct dose and that there's no air space taking up the dose, and make sure that everything is correct on that before you actually get to the point that you are administering the insulin to yourself. An important thing to note at this point is that when you give yourself insulin, especially if it's a short-acting insulin or an insulin that's going to bring your blood sugar down immediately, you want to make sure that you are giving yourself insulin at the same time that you are eating. So you should have your food in front of you and ready to go. Give yourself the shot and then be ready to eat right away. And the reason for that is because we want to make sure that you don't give yourself the insulin and then get hypoglycemic or have low blood sugar before you eat. So if you're going out to eat and you have to give yourself an insulin injection, make sure, very, very important, that your food is not going to be delayed and you give yourself a shot when your food is ready to be eaten. Don't take time to go answer a phone call. Don't take time to go for a walk after you have your insulin injection. Give yourself the insulin and then immediately start eating. In fact, you could even take a bite of food and then give yourself the insulin and then continue eating. Just make sure that you have that food on board so that you don't end up being hypoglycemic or having low blood sugar. All right. Now at this point, I want to demonstrate for you areas of the body that would be appropriate to give yourself an insulin injection. So I have a willing participant who's going to join me. This is Nate from Diabetes Support Services, and I'm just going to point to areas on his body that would be okay for you to give yourself an insulin injection. So one of the most popular areas is, of course, the abdomen, and most of us have a little bit of fat there. So basically we're looking at areas that have fat or subcutaneous tissue. So the abdomen is the easiest place and the most accessible place to give yourself an insulin injection. Now, if you're giving an injection to a friend or a family member, a lot of times the preferred spot is the back of the arm. So right here where the fatty part is, you want to make sure that you get a really good grasp of the biggest piece of the fatty area in the back of the arm. The other area that sometimes people like to give themselves injections are the outer areas of the thigh. So on either side of your thigh where you have some fatty area. And some of us ladies like to do it on the inner aspects of our thigh because we like to hold a little subcutaneous fat there as well. And then the other area, if you want to turn around, that people can give injections to themselves will be on the back of the thigh back here, or even on the back of your back if you have a little bit of extra subcutaneous there. And these are areas that are really more accessible if you're giving an injection to a friend or family member. Okay, thank you. So I'm going to demonstrate for you actually putting the needle into the skin on this little pad here that we use for demonstrations. So let's say this is an area of the abdomen, and you've drawn up your 5 units of insulin and you're ready to go with that. So it's important to make sure that you wipe off the area of skin that you're going to give the injection to with an alcohol pad. Make sure that we're getting rid of some of that extra skin bacteria that usually sits on our bodies. And make sure that you let it dry correctly so that it's cleaning the area appropriately. So you've got to the point where the area is dry and clean and ready to go. You've got your insulin injection. If you're giving it to yourself, then there's no need to wear gloves. If you're giving it to a friend or family member, you may want to wear gloves, not only to protect yourself, but to also protect the individual who's getting the injection from bacteria. So you'll take the top of your syringe off, and you've got your needle ready to go. You've made sure that there's no air in it. You've made sure that you have the correct dose according to your prescription. And you're going to just pinch up a little bit of the area to make sure that you have a good fatty area to put this needle into. If you're a very thin person, you'll have to do a bigger pinch. If you're a very large person, you have to do a smaller pinch. So when you pinch the area, you're going to put the needle directly in between where your 2 fingers are. And you just do it with a little mild darting motion. Not too hard to hurt the person or yourself, but not too soft so that you end up having to do it again because you didn't get the needle in. You just go ahead and dart it right in. You might just stabilize it by pinching it with this finger while you push the plunger down slowly with the other hand. Now be sure that when you give the insulin injection that you have the needle stabilized so that you're not bending the needle inside the skin, because you don't want to remove a syringe with no needle. Make sure that your syringe is very well stabilized when you go into the skin and not moving around a lot, because the needle is so easily bent. You don't want to remove the syringe and have no needle on it and leave it inside the skin. So make sure that it's very stabilized when you give the injection and then when you pull it out. Just pull it straight out. Verify that you've got that needle still on there, and then you're going to dispose of this in a biohazard container. This is a biohazard container. You're going to want to make sure that you have one of these, not a coffee can, not a Tide bottle, a legally certified red colored biohazard container. Some insulin syringes will have a little safety device that you can slide up to cover the needle. This one does not. You just dispose of it into the biohazard container and then store it in a locked area away from children and pets. Make sure that once these are filled, that you're correctly wrapping them up and sending them to a biohazard facility and not just throwing them away in your usual household trash. So once again, skin, wipe, let it dry, take the cap off, pinch the skin, gently dart into the skin, stabilize the needle, push the plunger down slowly so that all the insulin goes into the skin, remove the needle. If you have a little bit of blood, you can wipe it off with a cotton pad. Dispose of your needle in the biohazard bin and store in a locked place away from children and pets. This has been a demonstration of how to give yourself an insulin injection from Diabetes Support Services. I'm Kellyanne Garthy, RN. Thank you for joining us.